For part one of the immune system, we're going to be talking about the various organs that you will find within the lymphatic system and some of their roles and responsibilities in order to help maintain homeostasis within this system. Now, what you see on this first picture here is that I have circled two things, and these two things are what we are referring to as our primary lymphoid organs. Okay, everything else that is not circled is going to be a secondary lymphoid organ. And we'll talk a little bit more about these various organs as we go through this PowerPoint. But it's important to note that even though this is what's listed, a lot of things are actually going to be involved in helping with immunity. So, in regards to our functions of this system, the system is here to produce, maintain, and distribute lymphocytes, which are white blood cells, and other lymphoid cells in order to help keep us well and healthy. It's also going to return excess fluid to the bloodstream, and this will help with preventing edema. Now, whenever we get talking about how this lymphatic system is going to pick up this fluid within the tissues, you will see that there's not always going to be all blood that leaves the arteries that gets back into the venous return. Some of that fluid actually stays within the tissues, and so it is the job of the lymphatic system to pick up that excess fluid and get it back over into the cardiovascular system. When that does not happen, you will get pockets of edema in various locations because of the inability to return the fluid appropriately to the cardiovascular system. In this regard, it will also help maintain normal blood volume. And it will also transport hormones, nutrients, and waste. So, for example, it will transport digested fat into the blood via some specific structures that are called lacteals. And these lacteals are special lymphatics within the small intestine. That's what SI stands for. It's small intestine that will transport chyle. And we will be talking about how the lacteals do that in an upcoming slide. So again, keep in mind that all body cells and tissues are going to be involved in the production of immunity, not just the lymphatic system. I've listed a couple of different resources here for you, some web articles that are very easy to read, and they basically connect how other systems going awry or having problems can then cause problems in regards to immunity. So for example, the first one, that particular one is quite interesting because the discovery that people who had higher amounts of fat in their midsection, so around the belly, had worse fluid intelligence as they got older. Now, you may be thinking, well, what does obesity or intelligence have to do with immunity? But you'll see as we go through that there are going to be connections that are going to be involved in various systems. So whenever one goes bad, then the other one can also have problems as well. So more websites for you. The very last one, I really like that one because this talks about the communication between what's going on in the GI tract with the microbes, the healthy bacteria that is there to help keep you well, and how that necessarily affects the developing immune cells within the thymus. And remember that thymus is one of our primary lymphoid organs. It's very important that we keep the thymus healthy so that we can continue to make the T cells, which are the lymphocytes that will come from the thymus. And again, we'll get into that more later on, but it's extremely important that you keep in mind that the bone marrow and the thymus are our two primary lymphoid organs, and those must be healthy if we are going to maintain homeostasis within our immune system. So for pathogens, you must know that these are microscopic organisms that can cause disease. They come in various different shapes, sizes, and they can affect different parts of the body, but each will attack in a specific way. And whenever you're looking at these pathogens, it is the job of the lymphatic system to create the cells that are going to attack these pathogens so that they don't continue to attack you. So the whole goal is to win the war. Okay, so as we're going through this first PowerPoint, that's one thing that you definitely want to keep in mind is that the immune system is always it has to always be ready for battle, because it's going to constantly be bombarded and come across various pathogens, whether that's in our environment, in our food, in our water supply, etc. The immune system must always be able to defend you, just like the military should always be able to defend our country. So there is going to be a constant battle. You don't always know that these battles are going on. And if you have a very strong immune system, rarely will you feel these battles. You will feel them whenever your immune system goes down and the pathogens start to win. However, hopefully the goal is we can create enough cells that will fight these particular pathogens so that we win the overall war. Okay? And so that's what we're going to talk about today, is how this particular system actually does that. So again, when we're looking at this system, you got to know that it protects us from diseases. Like I said, all of the different types of pathogens we may be exposed to in various different realms, but also this lymphatic system will protect us against abnormal body cells such as cancer. So cancer is essentially an abnormal accumulation of cells. So these cells, they do not function like normal healthy cells. They oftentimes kind of go and do their own thing. They are basically like rebellious teenagers. They don't listen, they don't follow commands, they don't do what they're supposed to do. And this can then lead to various side effects that you will get from cancers. And it's the lymphatic system's job to ensure that they are responding to these cells before they build up to the point that it becomes a tumor. Obviously, we know that we can see tumors on imaging, but what you may not know is that every day your body is fighting against cancerous cells. And the goal is, of course, win the war. Okay, so you may lose a battle and you may have a buildup of abnormal cells leading to a cancer diagnosis. But then whenever you do certain things to make the changes to those cells, then hopefully you'll overall win the war. Your immune system, if you provide it with the nutrients and the factors that it needs, you will help your system win the battles and the war. So you should always be thinking about, how can I properly equip my immune system so that I don't end up with these horrendous diagnoses and have to pay a whole lot of money for treatments, because there are things that you can do to keep your immune system in a good shape, so that way you can have a good, long, quality, healthy life, not one that is miserable and filled with lots of doctor's appointments and hospital visits. So when we say immunity, what we're saying is the ability to resist the infection or disease. Resistance means the ability of the body to maintain that immunity. So for instance, if you get a particular infection, your body can fight it off, it can resist it, you can be immune to that. But you want to also be resistant. So you want your body to maintain that immunity and not lose that ability to constantly fight off these pathogens. When we're looking at the different components of the lymphatic system, of course, we will talk about lymphocytes a lot, because these are a huge part of the immune response, since they will identify, attack, and then develop that immunity and that resistance to specific pathogens. These lymphocytes are going to be produced and then mature in those two primary lymphoid organs that I spoke about, the bone marrow and the thymus. So those are our two big wigs. They're very, very important that we keep those things healthy and well, so that way they can give us the proper amount of lymphocytes that function at their full capacity. The lymphocytes can be activated in secondary lymphoid tissues and organs, and this includes the tonsils, MALT, which stands for mucosa-associated lymphoid tissue. That also includes the GALT, so that G stands for gut. So the gut-associated lymphoid tissue accounts for 70% of the immune system. This is why it's vital that you are cautious and aware of the things that you put in your mouth, because what you feed your body with will determine how well you equip your immune system for battle. And then finally, the lymph nodes and the spleen. And we'll talk about these various organs as we go through this PowerPoint. So whenever we're thinking about these various diagnoses that you see here at the bottom, I want you to think about specifically what organ system are you thinking of whenever you hear these diagnoses. A lot of times, whenever I say the word allergies, I know students think about the respiratory system because they're thinking like a runny nose or lots of sniffles and sneezes. If I say arthritis, oftentimes people are thinking about the skeletal system because we're talking about the inflammation at the ends of the bones. Constipation, of course, we think of GI. Depression, we would think of the nervous system because of the brain. And then acne, we would think of the skin, the integumentary system. But I have to tell you that all 5 of these diagnoses, even though you're thinking that they're involved with a different system, all of them can be related to your immune system. And it can go back to, what are you doing to prepare your body and to keep it in tip-top shape? So if we keep moving on, our different components of our lymphatic system, you have to know that the word lymph is related to a fluid that is very similar to blood plasma, but it does not have the plasma proteins in it. The lymphatic vessels are going to be the structures that carry the lymph from the peripheral tissue. So like, let's say your foot or your hand, they are going to carry that lymph from those areas back to the venous return system. So that way the fluid can get back into the cardiovascular system. Lymphoid tissues and lymphoid organs will be scattered throughout the entire body so that we can take care of everything systemically from head to toe. And then we have various lymphoid cells like the lymphocytes, which I already mentioned. We'll talk about those a little bit deeper when we get specifically into immunity. Phagocytes, which you should already know by now, are those cells that have the ability to engulf toxins, bacteria, cellular debris, etc. And then various other cells. So whenever we say other cells, for example, in the skin, there are immune cells there that are called Langerhans cells. And as we saw on the very first slide, your skin is going to be involved in this immune response. Your skin is a very large organ and it protects your internal from everything that you're exposed to in the external. And those Langerhans cells will sit inside of your skin and monitor these conditions to determine what needs to happen with the rest of the immune system if it feels you are under attack from a specific pathogen. So looking at this picture here, what you're going to notice whenever we talk about the lymphatic system is that green is going to be the most commonly used color. Usually all of the pictures, all of the models that you'll see in lab are all going to have green whenever we're referencing the lymphatic system. And so what you see here in this particular lady is you see many, many lymph nodes and lymphatic vessels. And so the lymph nodes are the things that look like little lima beans along the vessels. And so, of course, the vessels are the longer structures. And whenever you're looking at these lymph nodes and the vessels, again, it goes from head to toe. So you're going to see them everywhere. Whenever you look at the right side of the picture, what you see there is the other lymphoid tissues and organs, the tonsils. Of course, we're going to talk about those. They are the secondary organ. The thymus is a primary organ. I'm going to speak on that in a second. The spleen is a secondary organ. And then again, that malt you will find in various places where you have a lot of mucosa, whether that's in the GI tract, the respiratory tract, the urinary tract, etc. That will help provide protection to those specific areas. Now, in regards to the thymus, again, I said because this is primary, we have to take really, really good care of it. And whenever you're looking at the thymus, this is a tissue, or excuse me, a gland that is going to be incredibly quick at what we call atrophying. So the thymus will atrophy rapidly, if I'm correct, more rapidly than any other organ or tissue in the body. And so what generally happens is about at the age of 20, this organ will start to decrease in size, and decrease in function. So that's what we're saying when we say atrophy. So whenever you're looking at some of the reasons why this atrophy, research is being done to determine what can we do to actually help the thymus survive longer so that whenever people get older, they still have good immunity. You probably already know that whenever it comes to immunity, older people, especially in the geriatric population, are more prone to infections. And one of the reasons why is because of the atrophying of the thymus. So what they have found is that aluminum and other free radicals have really degraded this tissue and will cause problems. So there's a little link there that you can read, and it talks about how you can increase the antioxidants within your food in order to decrease the speed of the thymus atrophy. So you do want to be cautious, again, with the things that you put in your mouth, because this is going to determine how well you will win the battle or how well you will win the war. There are also supplements that you can take that will support the health of the thymus. And very often in patients that come to me and have cancer, I do want to make sure that that is the first organ that I am targeting because of its role in the immune system overall. Looking down at the inferior half of the body, you can see we continue on with our different vessels and our different nodes. And then if you look at the inside of one of the nodes, what you will see in there is you can see various lymphocytes along with the lymph. So again, head to toe, systemically, we are being covered in order to protect the entire body. Also on this picture, you can see the appendix, and we're going to talk about that a little bit later on because many people do not understand that the appendix actually has a function and a role because they have always heard that the appendix doesn't do anything and it does not matter if you get it taken out, but that is actually not true. All right, so for our lymphatic vessels, again, these will carry lymph. Lymph is specifically the name of the interstitial fluid that has entered into the lymphatic vessels. I'm going to show you a picture in just a minute of why some of this fluid would be left within the tissues. Remember, interstitial means in between the stitium, so in the tissues. Why would that fluid be left there? And why would it need to be picked up by those lymphatic vessels? So the lymph flows from the capillaries, which are the smallest structures possible, and then the structures get larger and larger and larger, eventually to the largest structure being the duct. So what I've done here on this slide is I have started with a very, very light blue because this is to represent small and tiny structure, and have gone all the way up to a dark blue with the ducts. Okay, so that's why ducts is going to be the darkest of them all because that is going to be the largest structure. So the lymph will flow from capillaries to vessels to trunks to ducts, and it goes in that specific order no matter where the fluid is coming from in the body. It will always go from capillary to vessel to trunk to duct. So let's look at the smallest component, the capillary. So this is going to differ from blood capillaries because, as you can see in the picture, it's not actually a complete tube. So this is going to be closed at one end. And that's what you can kind of see here is that we have this closed capillary bed. And what's going to be happening is you can see that this is a blood capillary. So you've got a red blood cell that's sitting in there. And as the fluid, or excuse me, the blood is coming into the tissue, remember gas exchange is going to occur within the capillary bed. So you're going to be able to exchange the oxygen and put it into the tissues, and then you can pick up the carbon dioxide to put it into the venous return system to take it back up to the heart so it can go back to the lungs to be reoxygenated. Remember, 90% of blood plasma is water. So whenever there is this transition as the fluid comes out of the capillary bed at the arterial end, not all of that fluid gets picked back up at the venule end. And because there is some fluid that ends up being left inside of the tissue, the lymphatic system is going to be the system that ensures that that fluid doesn't stay there. We don't want the fluid to stay there, because if it does, then this would lead to swelling of the tissue because the fluid would build up too much. And of course, we know swelling of the tissue is called edema. So in order to prevent this edema and return that fluid back to the cardiovascular system, which also helps us maintain proper blood volume, we have the lymphatic system here. So very often you will see the lymphatic vessels in between the arteries and the veins, because they will always run in those particular areas to help pick up that fluid that doesn't get transferred from the arterial end of the capillary bed back into the venule end of the capillary bed. So these lymphatic capillaries will also have larger luminal diameter. So you can see it looks to be a little bit wider than what you may be used to seeing from the vein. They do have thinner walls as well. Now, these capillary beds are made up of endothelial cells that are loosely bound together. So you can see that endothelium kind of lining around this little capillary bed. And you have the overlap of the endothelial cells that can act as a one-way valve. So this will allow all of the fluids, the solutes, any pathogens to enter into the bed, into the capillary bed, but it prevents their return back into the intracellular spaces because of those valves. It allows for just the one-way flow. And so that's what you can kind of see with the black arrows, is we've got the interstitial fluid coming into the capillary bed, and it's just going to flow in one direction because of those valves. Ultimately, remember, it's going to go from a small little capillary to a larger lymphatic vessel. And as you can see here, we've got lymphocytes that sit inside of these little capillary beds that can kind of monitor for those pathogens and make any necessary adjustments or changes as needed, so that way those pathogens do not survive inside of your system. So as I was saying earlier, you can kind of see the lymphatic vessels are always going to be intermingled in between the arteries and the veins. And again, what you can kind of see here in this picture, in the capillary bed on the arterial end, what we've got is fluid coming out into the tissue. Once the fluid leaves the cardiovascular system and gets into the tissue, then of course that's why we call it the interstitial fluid. Remember, it can't sit here though, because if it sits here, not only would we get edema, but you would also be more prone to infections because you have stagnant fluid that's just sitting here. So ultimately, we've got to get it over into the lymphatic vessel in order to ensure that it flows back up into the venous return. And I'll show you how that actually connects to the venous return here in just a minute. So when we're talking vessels, we have superficial and we have deep lymphatics. If we're saying superficial, these would be located in like the skin, the mucous membranes. Again, anything that's open to the external environment is going to have a mucous membrane. That would be your respiratory system, your GI system, your urinary system. Those are all open to the external environment, so they will be covered in a mucous membrane. And then the serous membrane is anything that's closed. So for instance, whenever we're talking about the thoracic area, like the thoracic cavity that houses the heart, the two lungs, those things are going to be lined with a serous membrane. They do not open directly to the outside. And then when we talk deep lymphatics, these are larger vessels that will accompany the arteries and the veins, kind of like you saw in the picture just a second ago. The vessels join to form the trunks, and these are the different trunks we have. We have a lumbar trunk that will drain the lower extremities and the pelvis, an intestinal trunk to drain the abdomen, brachiomediastinal and intercostal will drain the thorax area, subclavian will drain the upper extremities, and then the jugular trunk is going to drain the head and the neck. back. And then all of those trunks will basically empty into two major collecting ducts. That would be the thoracic duct and the right lymphatic duct. So whenever you're looking at this picture here on the left-hand side, what you can see is if we start again at this capillary bed where we have blood flowing out of the arterial side in order to oxygenate and provide nutrients to our tissues, it should be picked back up into the venule end, but not 100% of it will actually get back into that circulation. So any that's remaining will become interstitial fluid that needs to be picked up by the lymphatic vessels. Once it is picked up by the lymphatic vessels, it's no longer called interstitial fluid. Now it's called lymph. And that lymph will begin to flow through these capillary beds and then ultimately onto vessels. Along the vessels, what you can see are the little nodes that will just make their way along each of the vessels. So you can see a really big node right here. And then ultimately, those vessels will lead to trunks. And then the trunk will lead to the duct, and the duct is going to pour back into the cardiovascular supply. So that way we can maintain our proper blood volume and we can ensure that we don't have pockets of edema in various places within the body. Now, whenever it comes to our ducts, remember we only have two. We have the right lymphatic and then we have the thoracic duct. And as you can see on the picture here, the thoracic duct is going to do majority of the work. So the thoracic duct is going to cover all of these areas. So inferior to the diaphragm and from the left side of the upper body, whereas the right side is only going to do the right side of the head, the neck, the right upper extremity, and superior to that diaphragm. So just on the right side. So very, very little whenever it comes to the right, but majority of the flow will be returning back into the thoracic duct from the left-hand side in order to get back into the cardiovascular system. Now, lacteals, again, these are the little special lymphatic capillaries that we would find in the small intestine. And the purpose of these lacteals is to transport lipids from the digestive tract. So we do need fat. It is essential. Some of our vitamins are only fat soluble, so they will need fat to be absorbed. And so the lacteals will help with doing this absorption of your fat and your fat soluble vitamins. The lymph in the lacteals is going to get a different name. It has a milky looking whitish appearance because there is so much fat, and this is called chyle. So if it's in a lacteal, we're not going to call it lymph. Instead, what we're going to do is call it chyle. And so what you can see in the picture here is it is right in the center of this structure that's called a villus. So this villus is an intestinal structure. And so it's kind of like if you were to, wiggle your fingers a little bit. That's kind of like what a villus does, is kind of projects up into the intestine, and it has the cells on it that try to absorb lots of nutrients. So whenever we're looking at absorption here, of course, we want these villi to stand up. It is possible to do things that are going to flatten your villi, and that would be things like taking too many NSAID vitamins, drinking too much alcohol, exposing yourself to lots of toxins and poisons, maybe through cigarette smoking or vaping. There's lots of things that can cause these villi to become damaged, and if they do, then of course any nutrient absorption and or fat soluble absorption is going to be impaired. So as you can see within the green structure, the little lacteal here, we've got a structure that's called a chylomicron, and this comes from that word chyle. So remember, the chyle is that milky, fatty substance within the lacteal. Eventually, once these are in the system, they are going to be called chylomicrons. The lacteals will merge to form larger lymphatic vessels that will transport that chyle to the thoracic duct, where it is then emptied into the bloodstream at the left subclavian vein. So anything that gets into the thoracic duct will ultimately be dropped off into the left subclavian vein in order to be put back into the cardiovascular system. Lymph circulation is going to be maintained by normal skeletal muscle contraction. So that's why it's important to exercise and to work out. Because remember, we already said that this is a one-way flow. And one of the ways that it helps move the flow is by muscles contracting and squeezing those lymphatic vessels so that the lymph will actually move. Respiratory and breathing movements also will help with the lymph flow. And of course, as you know, whenever you exercise, not only are you contracting your skeletal muscles, you're also increasing your respiratory and your breathing rate, causing those organs to work more efficiently. And then we can also have movement through the smooth muscle within those lymphatic vessels themselves. On the right-hand side, you can see that these are some signs that your lymphatic system may be backed up. If you've ever heard of a lymphatic massage, now you may understand a little bit more why they do that in order to help move that lymph. So a sedentary lifestyle is what is going to cause that lymphatic system to be backed up, or eating really inappropriate things, having a lifestyle where you're exposing yourself to a lot of damaging chemicals or pathogens can also cause your lymphatic system to back up. Now, everything that you see on that picture there doesn't necessarily mean that those are only things that would cause your lymphatic system to back up, or those would only be the result of a lymphatic backup. Of course, other things can cause, for instance, headaches rather than just lymphatic system backup. But these are just some things that as you're going through and you're looking, hey, I know a person that suffers from this, and I know, maybe even yourself, hey, I suffer from like majority of these things. So maybe there's something that I need to do in order to help my lymphatic system. Our body is always trying to talk to us, but it will speak in symptoms. It doesn't speak in French, and it doesn't speak in Spanish. It doesn't even speak in English. It speaks in signs and symptoms. So watch your symptoms, pay attention to what's going on, and then use your knowledge of physiology to help yourself improve. When we're looking at the lymph nodes, as you saw them along the various vessels there, I want you to think about the lymph nodes as kind of like the trash collectors. So within the lymph nodes, we have these structures that are called germinal centers, and they can produce the lymphocytes to help fight off the pathogens. The lymph nodes will purify the lymph before returning it to the venous circulation, which is great because if you think about it, we don't want to have all of these pathogens going back into our venous circulation and then dropping off into our heart. So the lymph nodes are there to kind of pull all of that trash into that one area where they can then get to work on cleaning. So it's basically, we're bundling all the trash up, but then we're also going to be able to take the trash out. We're not just going to leave it sitting there. So the lymph nodes have the ability to remove 99% of antigens, and antigens are basically the foreign substances that are going to be markers to the immune system that come on the cell membrane surfaces of viruses, bacteria, parasites, etc., that alerts the immune system to say, hey, that looks abnormal, that doesn't look like me. So the antigen is basically the red flag that indicates to the immune system we have to do something. The antigens will be released due to infection, and they will enter the lymph and stimulate the macrophages and the lymphocytes within the lymph nodes. They are also carried by dendritic cells to lymph nodes, and then the macrophages can engulf those harmful pathogens. Remember, they can eat because they are phagocytic cells in order to render them harmless. So the lymphoid tissues in the lymph nodes will monitor those peripheral infections and then respond before the infections reach any vital organs. That's kind of the goal there. If you're looking at a picture of the lymph node, what you can see here, what I want to point your attention to, is that we have these structures that are called afferent vessels. Remember, everything is a one-way flow, so the little black arrows that you see are indicating flow of lymph. Okay, so what you see right here is you have 1, 2, 3, 4 afferent vessels, and you only have one efferent vessel. The afferent vessel is the way that the lymph actually gets into the lymph node, and the efferent is the exit. So because we have less efferent vessels than we do afferent vessels. What this means is it can slow the lymph down in this node so that our lymphocytes, particularly our B cells and our T cells and our macrophages, can take the time that they need in order to render those pathogens harmless before the lymph exits the efferent vessel. So this is like a lot of fluid that has the ability to come in at the same time, but everything is going to be checked before we allow it to leave the efferent vessel, because again, we want to collect the trash, but we also want to clean it up before we allow it to go back into the circulation. Now, if you've ever had swollen lymph nodes, maybe you've been sick and you've actually felt them within your neck, because we have clusters within our neck. We have clusters that are underneath our armpit, clusters in our groin. If you've ever felt swollen lymph nodes, then you kind of understand that they do have the capacity to expand and to grow. And here's some common causes of why the lymph nodes in the cervical region may be larger than normal. Okay, any large lymph nodes mean we're always fighting off an infection. So it's something to take into consideration whenever it comes time for treatment. Okay, so when we're looking at the lymph nodes, other than in the cervical area, underneath the armpit, and then in the groin, we also have lymph nodes within the gut, the trachea, the lungs, the thoracic duct, etc. Again, because we want to provide overall systemic protection. Whenever those lymph nodes are swelling, it's because the lymphocytes, or all the white blood cells, are coming into the area to try to attack the pathogen. So even though it's a painful thing at points in times, and maybe it can be even a little bit annoying, what you need to know is that your immune system is trying its best that it can in order to fight this battle for you. So these are the times where, again, you want to really pay attention to, what am I providing that is going to help the immune system do what it's supposed to do? Lymphadenopathy is going to be chronic or excessive enlargement of lymph nodes. As you can see in the picture here, your lymph nodes should never look like that. This can indicate a very serious infection or even potentially cancer. Lymphedema is blockage of lymph drainage from a limb. So what you can see at the bottom picture are 4 different stages. Usually lymphedema can be treated with compression, elevation, and massage if you're in stage 1 or stage 2. But if you get to stage 3 or stage 4, generally, because the lymphatic vessels have connective tissue, that their elasticity is now destroyed, you're not going to be able to go from stage 4 back to stage 1. So lymphedema will always cause severe swelling. It gets to pitting edema in stage 2, and this will definitely interfere with immune system function because of the damage to the vessels as well as to the nodes. So if you look at stage 4, obviously what you can see there is that we have excessive swelling that is going to be in that lower extremity. And with that means we've got stagnant interstitial fluid where toxins and various other pathogens can build up, and then you can have problems with your immune system not being able to address all of that. And then lymphoma. This is a general term for cancers that will start in the lymph system. It is possible for other cancers to spread through the lymphatic system, like, for example, breast cancer. You may know someone who has had certain lymphatic vessels removed from the area of their breasts because, again, all of the fluid has the capacity to systemically move through all the body, okay? And so if we say lymphoma, though, what we're saying is this is a cancer that started in the lymph system, not necessarily one that started somewhere else and is spreading through the lymphatic system. Exposure to radiation and certain types of chemicals can put some people at a higher risk for lymphoma. And generally, when we hear the terms lymphoma, people will say either Hodgkin's lymphoma or non-Hodgkin's lymphoma. So there are some of the differences between the two. And if we're looking at signs of lymphoma, then you can see on the right-hand picture, these are some things that you may experience. If you have a patient who is complaining of these things, then I would say definitely let's start doing a good solid history, physical exam, and a workup with labs to see what we're really looking at. The spleen is a very large mass of lymphatic tissue. As you look at the picture on the right-hand side, you can see that the spleen is going to sit on the left side of the body. So we've got the liver on the right, the gallbladder is inferior to the liver. And then as we start moving over to the left, we've got the pancreas, the stomach, and then the spleen is the furthest to the left. So the spleen is going to remove abnormal blood cells and other blood components by phagocytosis, and then it will recycle the hemoglobin. It will recycle the iron. Remember, our red blood cells only live for 120 days. So if there is an abnormal blood cell, then it can go earlier. The spleen can remove it, and it can take different components that your body can still use and recycle them, so that way you can get some new healthy red blood cells. The spleen will also initiate the immune response, and it stores blood for release during hemorrhage. Phagocytes and other lymphocytes in the spleen can identify and attack damaged and infected cells in the circulating blood. Now, it is possible to live without a spleen. If you have your spleen removed, it's called a splenectomy, and the liver can take over. However, the spleen is, of course, an immune organ. And whenever we're talking about the liver taking over, the liver's not going to be able to do everything at 100% efficiency like the spleen does. So therefore, your immunity and your resistance can potentially decrease if you do not have a spleen, at which point in time you have to be more cautious about how you take care of your immune system so that you can win the battle. Tonsils. We have 4 different types. So we have palatine, which stands for underneath your palate. Pharyngeal, now oftentimes you will hear people call this the adenoid. So that's an AKA. Tubal, which is going to be near the area of the eustachian tube. And lingual, which is referencing tongue. So underneath the tongue. The tonsils will protect the nose and the oral cavity, but they do have the capacity to kill any pathogens or attack any pathogens that are coming into your system, either through what you're breathing or through what you're eating. So the tonsils are also very important. A lot of people think that just by removing the tonsils, that's no big deal, and maybe that will help with eliminating tonsillitis, which is inflammation of the tonsils. If they have chronic tonsillitis, what I would suggest is to figure out the underlying reasoning why, instead of just taking away one of the lymphoid organs. It's ultimately trying to do its job. So the tonsillectomy should definitely be reserved for situations where that person maybe is having trouble breathing, and they can't do anything in order to help the situation. My sister has had her tonsils removed, and she is constantly sick. So it definitely does interfere with your ability to build that immunity and resistance. So I'd encourage parents to really look into what's going on with their kids' tonsils before they just sign them up for a surgery and have them taken out. And then Peyer's patches. These are going to be found in the walls of the small intestine. So this is going to be mainly in the ileum, which is the distal portion of the small intestine. The Peyer's patches help keep the intestinal flora regulated. We have to have good, healthy bacteria, and that good, healthy bacteria is called our microbiota, or our normal flora. Okay, so flora is our good, healthy bacteria that's absolutely essential to maintaining homeostasis. We are actually more flora than we are human cells. So the bacteria cells beat us out in number by about 10 to 1. And that intestinal flora helps with regulating the pathogens, keeping everything under control within the GI system in order to prevent these infections. The Peyer's patches are also a dominant source of IgA, which is immunoglobulin A producing cells, and the IgA can protect the mucosal tissues from microbial invasion and maintain the immune homeostasis within the microbiota. Again, why you have to watch what you eat, because you want to ensure that you're feeding yourself with good, healthy bacteria so that your body can defend and fight against any pathogens. So whenever you're looking at this picture here, what you see is the Peyer's patches, the little blue dots, they're kind of showing you in the entire area of the small intestine, but really for us, about 50% of those Peyer's patches, if not more, are going to be found in the distal segment of the small intestine, which is known as the ileum. And then we can see the appendix that is listed there in yellow. And so let's talk about the appendix, because people have some thoughts about that as well that aren't always accurate. So what can the appendix do? Because a lot of people think that the appendix has no role to play. And again, it's one of those things where we can just take it out without a problem. That is not true. So yes, it used to be considered what's called a vestigial organ, meaning it's not needed or has no function, but that is not accurate. So now we know, because remember, science is always working to look deeper once we have greater ability, greater technology, greater knowledge and awareness, things can change. So don't stay stagnant and think that you know everything just because you read it in a book or, you hear it in a lecture. Always read and continue to educate yourself, even when you're out there in the field, because you don't know how well that is actually going to benefit your patients. So in regards to this appendix, as you can see there, number one listed is the reservoir of commensal bacteria. And again, I talked about the commensal bacteria, that flora that is necessary in order to maintain homeostasis. But what we have found is that the appendix actually has the ability to harbor this really good bacteria, so that whenever you get sick, maybe you get food poisoning, or if you travel somewhere and you get an infection, you go on antibiotics. Anything that's going to cause your good, healthy bacteria to be depleted out of the system is going to be bad for your immune system. And so the appendix, if you still have it, it will harbor all of this good bacteria to help repopulate and reflourish your intestines during those times when you are sick or you are taking a medication that's negatively impacting your normal flora. Very, very important. So if you don't have an appendix because you've already had an appendectomy, then it's important, again, for you to understand, make sure that you increase your foods that are rich in good bacteria. So that would be kefir, kombucha, sauerkraut, kimchi, things of that nature that are really, really high in good beneficial bacteria, since you don't have this particular structure that can harbor it for you. Appendicitis is, of course, the most common pathology of the appendix, which just means inflamed and swollen appendix. It does not always require surgery every single time. Of course, if it has burst or ruptured, then yes, that is an emergency surgery that is absolutely necessary. But other than that, it is possible to calm that inflammation down in order to keep your appendix, of course, depending upon what your labs and your scans show with that. So that's it. So for our immune system, if we go back again to the top, remember that it is not just about one or two organs that do a whole lot of the work. It's about the entire system. It's about what you provide to the system, what kind of choices that you make in your food, what kind of choices that you make in the things that you actually are around. Even stress can negatively impact this system. So it's very important to live a well-rounded lifestyle if you want to have an immune system that works in good balance and you live a long quality of life because of it.